Good morning, or yeah, good morning for the next 3 minutes.
Oh, good morning. Sorry, I was on mute.
No, that's fine. Let me see who's host. Who is NC Child this morning?
Hi, yes, I'm the host. I can assign you host right now.
Perfect. Let me ask a quick question before you do that. Do you, oh, you're gonna assign me host first and for me to do it?
Yes,
Okay.
yes, I
Okay, okay.
can.
Yeah, make me full host just for a moment. Oh, you did, but I don't see interpretation be enabled. Let me make sure. Oh, no, you made Leo host.
Oh, whoops, sorry, 1 second. Hey, Leo, would you be able to assign the host back to NC Child? So sorry.
I can certainly try
Just click on the name
on my name.
on NC Child name where the three dots are.
Got it.
Yeah. There you go.
Child is now the host.
Yeah. And the one that doesn't have a name, the one that is not William, but just Spanish interpreter. Yep, I'm the host and interpretation is enabled. So I'll go ahead and do this. I wanted to ask you another question. Do you want me to make an announcement or just put information in the chat?
Well, just my computer's running slow. Mortado, I was gonna cue you in, just have a brief hello, thanks everyone for coming, and then turn it over to you
Okay.
to include whatever you needed, and then if you just want to turn it back to me after that, that
Okay.
would be great.
Okay, that works. Perfect.
Hi everyone, thank you all for being here today. Before we get started of intros and titles, I'm going to hand it over to Mortado for our translation and interpretation services.
Thank you so much for doing that, and I'm sorry about the long pause. I was getting connected to the interpretation automatically. So welcome everyone. As you know, all of these meetings have Spanish interpretation available. So in order to create a fully bilingual space, what we need is everyone to Speak a little slower when you're presenting, particularly if you're reading. This is essential. And for those who speak Spanish, la interpretación está disponible en la parte inferior de la pantalla. Pueden ir, a ver, van a la sección donde está ese globito de ese globo terráqueo, hacen clic ahí y seleccionan español. De esta manera pueden escuchar la interpretación durante toda la sesión en español. Si no ven el globo es porque se esconde bajo los tres punticos y van ahí, ponen interpretación, luego ponen español y terminado. De esta manera pueden poner. Igual voy a poner las instrucciones en el chat. Now, should there be a comment in Spanish in a Q&A section, go to the globe and select English. That way you can hear that comment in Spanish in English. I'm going to anyway put the instructions in the chat for everyone. And I think that's all for me. Have a great meeting. Back to you.
Murtado, thank you so much. It is always a joy and a pleasure to have you on. For everyone who's joining us for your lunchtime, thank you for spending lunch with us. As always, please eat while we go through a lot of this. But wanted to again just thank everyone for being here live or virtually afterward. We are going to have a great meeting today. We're focusing all on Medicaid. So for those that don't know, my name is Hannah Preston, and I'm the Health Policy Manager at NC Child. In this role, I have the pleasure of working with amazing partners like those joining us today from the Georgetown Center for Children and Families. We have Leo Coelho, who's a research professor at the Georgetown University McGirt School of Public Policy and Center for Children and Families, and Amber Mosher, Vice President of Health Policy and Coverage at GMMB. We also have an NC Child Administrative Assistant, Ariana Fahey, joining us. She's next to me right now running technical assistance. As a reminder for our speakers to cue Ari in when you need to move to the next slide and to speak a little bit quietly or a little bit slowly so that our interpretation services can be provided. So today we have a super packed agenda. We'll have Leo start us off to discuss the new report released by his team, which highlights how critical Medicaid is in North Carolina, especially in our rural counties. We will then go into a highly requested breakdown of the implications and risks for North Carolina's children and families due to the anticipated federal cuts to Medicaid. He will then hand it over to Amber to highlight the importance of messaging and advocacy like this, followed by a great toolkit that shows what you can do in your roles to advocate against federal Medicaid cuts. I'll close us out by talking about the Medicaid defense projects that NC Child is doing, ways that you could get involved, and hopefully ways that you can mimic the projects that we're doing in your own organizations. Throughout the presentation, if you have questions, please put them in the chat. We will be ending the day with a Q&A. For any questions that we cannot get answered, we will make sure we follow up in an email with this recording as well. Without further ado, I'll hand it over to Leo.
Good afternoon. Welcome, everyone. I want to thank you, Hannah and NC Child, for inviting me and for your leadership in the state to organize this important conversation. I'm here because our situation is a red alert, and incredible timing, actually, because we even have breaking news this morning, which we'll get into. What we're going to do is talk about how important Medicaid is to North Carolina and rural communities, but then we're going to talk about the incredible threat to the Medicaid program that is right in front of us. And my friends, this is not a drill. This is happening right now, literally this morning. Normally, I'm kind of fun and happy, but you all are going to get scary Leo today. And I'm sorry about that. Next slide, please. So we're going to start by talking about how important Medicaid is to North Carolina and rural communities. And this is the happy part of my presentation. Next slide, please. Just to put this all in context, let's remember that Medicaid is the nation's largest health insurance coverage program, insuring about 70 million people. And as I talk about this, I'm going to lump CHIP, the Children's Health Insurance Program, which covers the tier of kids just above Medicaid eligibility levels. I'm going to lump that in with Medicaid throughout. Together, Medicaid and CHIP, this 70 million people, as you can see, that's more than Medicare and the marketplaces combined. It's a lot of people across the country depending on Medicaid, and not enough people realize how important this program is. Next slide, please. As important as it is nationally, if we look specifically at North Carolina, we can see what it's doing in North Carolina is incredible. Medicaid and CHIP cover 2.8 million people in North Carolina, including 1.4 million children. So that coverage includes 38% of all births in the state, ongoing coverage for 41% of North Carolina children. And it's not just kids and babies. It's also 61% of nursing home residents, their health care, and their nursing home placements are covered by Medicaid. So everyone in North Carolina has friends, family, neighbors, coworkers who are being supported by Medicaid right now, whether they know it or not. And nationally, I want to flag that Medicaid is also the largest payer for substance abuse disorder treatment and for mental health services. So if you care about the opioid epidemic, which has hit rural America particularly hard, and if you care about mental health, you have to care about Medicaid. Next slide, please. Now, if we're talking about Medicaid in North Carolina, we also have to talk about Medicaid expansion. I'm sure most of you know all about this because I'm sure many of you are the people who fought for Medicaid expansion. In just over a year, over 600,000 people, most of them workers and working families, are now covered through North Carolina's Medicaid expansion. I don't like to play favorites among states, but I have to tell you, North Carolina's expansion is a big deal. It has blown us all away how fast North Carolina got so much done. Georgia started its Medicaid expansion just before North Carolina and has less than 10,000 people enrolled. And we'll come back to Georgia. But there are a lot of people across the country pointing to North Carolina as the model, the way forward for Southern states. You have built something to be very proud of. Your expansion provides incredible support to working families. That means healthier parents, more stable employment, more stable households, no more medical bankruptcies, right? We could go on and on, so many benefits. It's also a huge win for kids. And that's important because the people who are against Medicaid expansion, they sometimes say that expansion distracts states from caring for kids, right? If we care for adults, we can't care about kids. The exact opposite is true if we actually look at the data. When parents have coverage, kids are statistically more likely to be covered. And it should be pretty obvious that kids do better in a stable household and that kids are going to do worse if their parents are sick or even die from preventable health conditions. One of the greatest things about your expansion is that it was a bipartisan labor of love and is popular across the political spectrum. And my friends, this bipartisan North Carolina expansion that you should be so proud of is at risk today from federal cuts, which we'll discuss more. Next slide, please. Now, my job is to analyze healthcare, but it's really important to understand how Medicaid funding works for North Carolina and how absolutely essential it is to the state budget and every policy goal your state has. Like Medicaid is like water or oxygen for your state budget, right? You can't live without it. And I'm going to tell you a little bit about how Medicaid funding works so you can understand the threats that are coming. North Carolina, like all states, gets open-ended federal matching dollars for state Medicaid spending on healthcare. So as the state has healthcare needs and spends money, it draws federal dollars, matching dollars. And the federal dollars always rise to match the state needs. So state needs go up, federal dollars come in. And that's crucial because guess what? Enrollment and healthcare costs only go one way, right? They go up. For every dollar North Carolina spends, it gets $1.83 in normal federal matching funds. For 2024, federal funds made up about 68% of total North Carolina Medicaid spending. So the state is paying 32% of the cost. So I just want you to imagine this, a birth, right? That costs a little over $10,000. Let's say it costs $10,000. The state would pay $3,200 for that birth, less than a third of the cost. With Medicaid, North Carolina can pay for more than 3 births with $10,000. you're getting 3 for the price of 1. So imagine if Medicaid goes away and you still have the same number of births to pay for. Now imagine the same thing if we apply the example, you've also got people in nursing homes, which are $800 a month, $8,000 a month, right? So federal Medicaid dollars coming into the state are amounting to $18.8 billion for North Carolina. That's a huge source of revenue and a massive driver of jobs and commerce in your state. And those federal Medicaid dollars, they make up 71% of the federal dollars that come into North Carolina. So I'm going to show you 2 pie charts, and I don't want you to get lost in the details. Just look at the story that comes out of these 2 pie charts as we look at them together. Next slide, please. This pie chart shows you federal money coming into states. This is national data, not North Carolina specific. Federal Medicaid dollars are dark blue here, and they are more than half of the dollars coming into states. In fact, they average 56 nationally. In North Carolina, it's 71%. So it's even way higher than this blue section. So way more federal dollars are coming in for Medicaid than for other priorities like education, which are pink and green. You can see how much less federal dollars are coming in for education. Now let's go to slide 8. But when we look at what states are spending their own state dollars on, what do we see? On average, states are spending much less than half on Medicaid, right? In dark blue. It's actually less than a quarter. And education in green and pink is where states are putting their state dollars to work. And indeed, when we look at the North Carolina data, what we see is that the state is spending less than $9 billion of state dollars on Medicaid and is spending over $20 billion of North Carolina dollars on education. So what you need to see is that all of those federal dollars that are coming in for Medicaid are allowing the state to spend twice as much of its state dollars on education as it does on Medicaid, because the state is getting a lot of Medicaid money from the feds. If you take away the federal Medicaid dollars, yes, that hurts healthcare, but also education and other state priorities. Because how does the state sustain its high spend on education if it loses the biggest source of federal revenue, Medicaid dollars, which is allowing the state to spend less on healthcare and pile money over into education, right? So you should care about Medicaid because healthcare is people's lives and well-being, but you should also care because if this gets funding, you probably also care about education and other state priorities. Next slide, please. Now, Medicaid is important in every state, but man, is it really extra important in states with lots of rural areas. And this is what we found in the report we just released. In North Carolina, Medicaid and CHIP cover 49%, basically half of all children in small towns and rural areas. So rural counties are really relying on Medicaid. We actually found 6 where the counties are covering over 55% of kids through Medicaid. We have county maps available in the report if you're interested in that kind of data. So Medicaid is really important to rural areas. And what do we know? Well, North Carolina has the second highest number of people living in rural areas of all states, 2.2 million. Only Texas has more, and Texas is gigantic. Not surprisingly, North Carolina also has the second highest number of children in rural areas covered by Medicaid and CHIP. Again, second only to Texas. Next slide, please. Now, another one of the important roles Medicaid plays is that it supports states during public health emergencies, for example, natural disasters like Hurricane Helene. Remember how I talked about the open-ended matching funds? That means when the state suddenly has a huge surge in needs, the federal funds are still available. There is more federal money available in hard times. It makes Medicaid really special. And so that makes this a terrible time to cut federal dollars for North Carolina when the state needs that open-ended funding to support counties impacted by Helene. A final really important role Medicaid plays in rural areas is keeping hospitals and providers open. Rural hospitals have more lower income patients, and so they rely on Medicaid payments to literally keep the lights on. Next slide, please. And this is really serious. Since 2005, 12 rural hospitals have closed in North Carolina. Of the ones still open, 14 of them, a quarter, are losing money on the services they provide. A report finds that 10 are at risk of closing, and of those, 7 are at immediate risk of closing. Rural hospitals are the ones losing money, and in North Carolina, the 11 hospitals with the highest rate of losses, really big losses, are all in rural areas. So if you slash Medicaid funding for North Carolina, some of these hospitals that depend on Medicaid reimbursement are going to close. And that has health impacts for people in rural areas who have nowhere else to go. And also it has economic impacts. These hospitals are big employers and the economic engines of some of these rural counties. Next slide, please. Okay, so that's our whirlwind tour of how important Medicaid is. Let's talk about the cuts that are being considered literally right now as we speak. Next slide, please. So Republican federal legislators are considering massive and historic cuts to federal Medicaid funding. They are interested in various legislative priorities, border funding, tax cuts, which lose money for the federal government, and they're proposing to cut Medicaid to help pay for those things. Nobody knows exactly how much they're going to cut it. Not even they really know for sure yet. But we do have a few data points, and it's bad. The House Speaker committed to making $2.5 trillion in total cuts, not just to Medicaid, total cuts in negotiations last month. $2.5 trillion is an absurdly high number. Just a fraction of that would be catastrophic. We also know that the House Budget Chairman circulated a menu, and we'll come back to this menu, listing $2.3 trillion in possible Medicaid cuts, different ideas on how to cut Medicaid. Doesn't mean they'll do all of that, but even if they did a quarter of it, Medicaid would be gutted. But now we know more. We have some breaking news, which I'll get into. Let's just outline the process here. The Democrats could filibuster any normal legislation they tried to get through the Senate. So the Republicans have to use a special legislative process called budget reconciliation to get around the filibuster. Fancy process. It's a simple two-step process. First, they have to set savings targets for the different House and Senate committees, and then the committees design policies to hit their savings target, whatever that is. When I woke up this morning, the latest we heard is that the committees that handle Medicaid may have a 200 billion or maybe 300 billion target. Just 30 minutes before this call, we actually saw legislation that the Budget Committee is reviewing with a target of 880 billion. And that is a minimum savings target that the committee that handles Medicaid would have to hit. Even 200 billion would be really bad. So 880 billion is just totally unfathomable. The House Budget Committee is proposing 4.5 trillion in tax cuts. So the reason they need this big number from Medicaid is to finance those tax cuts. So it's very concerning for Medicaid funding, but it won't be easy for the Republicans also, because even with reconciliation, they still have very narrow majorities. So they can't afford to lose, for example, a legislator who doesn't want to see their state harmed by cuts. Next slide, please. So let's get into this menu. What's on the menu of cuts? Well, the short answer is a lot. But I'm going to focus on 4 things that have the biggest impacts nationally and specifically for North Carolina. So we're going to cover per capita caps for block grants, reducing Medicaid matching rates for states, including Medicaid expansion, eliminating or reducing the use of provider taxes, and mandating states to use work reporting requirements. And all of these and many more are in legislative proposals being considered right now. And they would all slash North Carolina Medicaid. Next slide, please. Per capita caps, or a related policy called block grants, both do the same thing in that they end that open-ended funding for states, replacing it with a lowball capped amount. So as North Carolina spends, at some point when it needs more, the feds hit their cap, and then all of the remaining spending the state has to do by itself. When the federal money runs out, there's no more federal money. They could target such a cap on all Medicaid funding. They could target it on Medicaid expansion only, which is an idea they've been floating. Don't get lost in the mechanics of capping and all these details. It's a cut. It results in a gigantic funding cut for North Carolina, a cut so big it's impossible for the state to make up for it. The GOP menu lists it as saving $900 billion. And in 2022, the Congressional Budget Office estimated it would save $921 billion. So this is a huge potential cut. This is the single worst thing they could do, probably. The only good thing is that it's so bad that they're a little afraid of doing it, which is why maybe they've raised the possibility of doing it only for the expansion group. Next slide, please. So we just covered that they could slash funding by putting a cap on federal dollars. Another way to do it is to reduce how many matching dollars states get for each dollar they spend. And so the GOP proposal has several ideas to lower the matching rates. The main idea that would hurt North Carolina is lowering the matching rate for Medicaid expansion. They also have another idea to lower a minimum matching rate that applies in a dozen states, which is also very harmful for those 12 states, but it doesn't impact North Carolina. Their proposal for Medicaid expansion is to lower the matching rate from the current special 90% matching rate to the state's standard match rate, which is 65%. So instead of the federal government paying 90% of the cost of your Medicaid expansion, they would drop their payment levels down to 65%. So if you view that from the state's perspective, your cost for paying for that expansion goes from paying 10% of the cost to paying 35%, right? It would more than triple the state dollars you need to fund the same coverage. That would already be enough to make it unaffordable. But we actually don't have to do any math here, because you also have a trigger in your state expansion law saying that if the special 90% match goes away, the state must drop expansion. So if the federal legislators make this change, your state expansion disappears, and more than 600,000 people are going to lose their health insurance, unless your legislature goes back and undoes that trigger law and then triples the state funding, right? So like, don't go betting on that. Next slide, please. Our third one is a little more nerdy, but it's also quite important. States struggle to pay their share of the Medicaid costs. One way states can raise money for their state share is through provider taxes. The state basically charges a tax on providers, like hospitals, and they use that money to pay the state's share and get the federal matching funds. Hospitals tend to support this because it's better than getting their rates cut if the state has no money. On average, states finance 17% of their state dollars this way. So this is where 17% of the Medicaid money is coming from. The GOP proposal would reduce, maybe even eliminate, the use of those provider taxes. That would reduce North Carolina's ability to raise dollars for Medicaid, which in turn means no federal matching dollars. So they're basically making a large federal cut by making it impossible for North Carolina to raise those state dollars needed to get the federal match. And on average, right, it's almost 20% of state programs at risk. The GOP proposal to reduce provider taxes would save $175 billion, but the CBO estimate for fully eliminating it would save $609 billion. So there's plenty of downside here. Next slide, please. The last major terrible idea on the menu is to add a work requirement to Medicaid. The GOP proposal would force North Carolina to use a work reporting requirement. We don't know exactly for whom, but likely targeting Medicaid expansion and maybe other adults. Work requirements lead to a massive loss in enrollment and funding because most people, including workers, get terminated from Medicaid when reporting requirements trip them up. As we discussed earlier, North Carolina started its Medicaid expansion just over a year ago and has over 600,000 people enrolled. Georgia started its Medicaid expansion at the same time, but they have a work requirement model, and they have enrolled only 6,500 enrollees. So if that kind of model got forced onto North Carolina, you would see huge losses to enrollment in your Medicaid expansion. The GOP proposal lists this as saving $100 billion. The CBO has estimated $109 billion. Next slide, please. On this slide, you can see other cuts that were on the menu. I'm not going to go through them all. You're welcome. But I'll just highlight the first one that could be especially impactful for North Carolina. Recall that to encourage new states to expand Medicaid, Congress in 2021 law offered states bonus money to expand Medicaid. North Carolina expanded and is getting the bonus money. And the Republican menu is proposing to eliminate the bonus payments. So that would impact 4 states that expanded through 2021, since 2021, and one of them is North Carolina. That would save the Republicans $18 billion in their package. Next slide, please. So I want to wrap up by pointing out that these significant cuts to federal funding are really a large cost shift onto states. States would, in theory, have to dramatically raise taxes or severely cut other parts of their budget, especially education, which is 43% of the state budget. But the federal cuts are so big that they can't fill that hole. And at the same time, they might restrict the use of provider taxes, which is the state's best tool to raise money. So it would be harder to maintain current spending, much less raise new revenue to compensate for the federal losses. And so what's going to happen here, folks, is that if your state gets these federal cuts thrown on it, it would have to make deep and damaging cuts to the Medicaid program in the areas of eligibility, meaning less people covered, benefits, meaning less services for the people who are covered, and provider and plan payment rates, right? And so the already low provider rates get further cut, making access problems even more challenging. These policies are a giant cut of federal dollars, which translates into giant state budget program problems, which eventually leads to giant Medicaid cuts, right? And all of this is being debated in Congress at this very second. So that, I'm sorry, is my sad report. I'm going to pass the baton on to GMMB, and then during Q&A, we can take up more about this.
Leo, thank you so much. I know that we went through a lot and there are constant changes. I know when we originally talked about planning for this meeting, we had no idea what we would be updating on. So the fact that there were changes 30 minutes before this shows how fast-paced these changes are. Again, wanted to remind folks to please utilize the chat. I know that we had a lot of information thrown out to you. So again, no question is a dumb question. Please put them in there and we'll make sure to address them at the end. Now we will hand it over to Amber, and we're going to have Ari pull up those slides, and then we'll have you get to it.
Awesome. Thank you so much. That's a tough act to follow, Leo, but I'm going to do my best. Thank you guys so much for having me this afternoon. I'm Amber Mosier, as you can see, a Vice President of Health Policy at GMMB. As luck would have it, I was born and raised in North Carolina in a rural community. I had to drive 30 minutes to get to my high school. I think I had to drive about 20 minutes to get to the closest hospital. And I come from a working family. Both of my parents worked. My dad was a construction worker. My mom worked in retail. So Medicaid is how I got health care. It is how I got my vaccinations. It's how I was able to see a doctor when I was sick. So this topic is really close to my heart and happy to chat with you guys about storytelling today. Let's go to the next slide. So what I just did was tell a little story. I told you about me. I told you about how I grew up and why Medicaid is important to me. And my hope is that it got your attention a little bit, and it made you feel connected to me in some way. Hopefully there are some pirates or Tar Heels out there. We could connect on that in different ways, but that's the power of storytelling. It takes the really complex and brilliant information that Leo just shared, and it puts a human face to it. It reminds us that federal Medicaid cuts, it seems very abstract. What folks are doing up here in DC might not seem super relevant to what you're doing in North Carolina, but the fact is, it's going to hurt kids like me. It's going to hurt families like mine. And it's going to be devastating if those cuts happen. So let's go to the next slide. So storytelling is a really great tool when it comes to advocacy. It's a great tool when it comes to education. Just like I said, putting a human face to data and statistics. Sometimes folks can get lost in the sauce. You talk about data and statistics, and they're very compelling, right? It's a story on its own. But when you pair that with stories about real people, real healthcare providers, real small town business owners, it really helps folks understand the real life impacts of something like cutting federal Medicaid dollars. So we partnered with Georgetown to support this rural report with a communications toolkit to help folks tell the story of North Carolina and how Medicaid supports your rural communities. We created some social posts and graphics. We wrote a template blog or op-ed for you. We drafted a sample policy maker letter that you can see here. So just wanted to share that with you guys, and NC Child is more than welcome to distribute those if those would be helpful. But these are the types of things that you can use to spread the word, to make your voice heard, and to elevate some of the personal stories that put a face to North Carolina's Medicaid. Next slide. So just briefly, for the next 3 slides, I know there's a lot of words on the slide, so forgive me. But what I want to do is kind of help shape the narrative, if you will, help shape the story. And reiterate what Leo just talked about when it comes to potential cuts at the federal level and how that will affect North Carolina's small towns and communities. So, number one, federal Medicaid cuts are going to cripple the state's budget. Done, end of story. There's no way for the state to make up for the volume of federal dollars we're talking about. There's no way for them to raise taxes on residents. There's no way for them to cut funding in other ways to make up for this massive loss in funding. And like Leo said, people's healthcare needs aren't going to change. People are going to get sick. They're going to get hurt. They're going to need to see a doctor. That's going to happen whether or not they have Medicaid. So that means that hospitals are still going to have to take in folks who are sick and hurt and injured who did have Medicaid. Now they don't. And so those hospitals are going to be sort of left holding the bag with this uncompensated care. And then the state's going to do what it can to really cut down where they can, trim the budget where they can to make up for some of these losses. That's just how the budget works. So part of that may be that they're going to have to reduce eligibility. So fewer folks are going to be eligible for Medicaid. Like Leo mentioned, part of it may, or sort of a downstream effect of the federal cuts may be that Medicaid expansion goes away and 600,000 people lose their coverage overnight. This is a really scary scenario, but it's one that folks in North Carolina and folks in rural communities across the country have got to start grappling with. And then a really important point is that cuts like this aren't just going to hurt folks in North Carolina with Medicaid. It's going to hurt everybody, all the taxpayer dollars who pay for healthcare. We're all going to pay more for healthcare because less folks are going to have coverage. Hospitals and clinics are going to have more uncompensated care. That means that the costs are going to go up for everyone. Next slide. And then a big one, this would have meant a lot to my family when I was growing up. It's going to mean a lot to families across the state. It is impossible to cut the state Medicaid program without hurting kids and families. Again, end of story, period. Leo mentioned the volume of kids in particularly the rural areas that rely on Medicaid and CHIP for their healthcare coverage. So we're going to see a lot of kids lose their healthcare coverage. A lot of folks are going to lose their healthcare coverage. They're not going to see a doctor when they need to. They're not going to get that preventive care that you really need in order to stay healthy. And it just sort of snowballs. You're going to lose work. Folks could lose their jobs. That's going to hurt the workforce. It's going to hurt the economy. And then as kids and families lose healthcare coverage, that medical debt, which is a really scary thing for families, is going to start to tick back up. I was a sick kid. I had pneumonia a lot. If I hadn't had Medicaid, I still would have had to go to the hospital because I was so sick. And so my parents would have been shackled with that medical debt, and that's a really scary thing to think about. So that could happen to other families in North Carolina. Next slide. Guys, I wish I had better news. I feel like this is a downer, but we want to really just leave you with the feeling that this is a real crisis on our hands and there's something that can be done. So again, using stories to share this information, to write to your lawmakers, to tell them that Medicaid is important to you, it's important to your state, it's important to your economy, and to protect North Carolina's Medicaid. So the last point here is that loss of funding is going to really, really hit the rural healthcare system hard. It's going to hit the rural economies hard as well. Like Leo mentioned, there's a number of hospitals in rural North Carolina that are already at risk of closing. If we take away the patients, the Medicaid payments, the possibility of those hospitals closing is going to increase. That means that folks who work there could possibly lose their jobs. That means the corner store, the medical supply store down the corner that's been there for 50 years might have to close its doors as well. So again, the trickle-down effects are significant. And yep, hurts the workforce, hurts the economy. I think that is it for me. So again, when you're telling the story, sort of these are some main points that you can hit. And love North Carolina. Let's keep healthcare coverage, folks.
Amber, thank you so much. I feel like that shows some key things that folks can do. The biggest question I think we've had is, what can we do about it? What does that mean for the organizations that are here and the families that have lived experience? So thank you for kicking that off to further that conversation of tangible things that we can do. I'm going to continue that a little bit more before we get into the Q&A of what action steps look like, ways to advocate maybe a bit differently than what we're seeing right now. So this is a project that NC Child is running right now. It is a two-part project. So knowing that Medicaid was expanded a little over a year ago, we want to highlight how important that is for families in North Carolina. And so we're looking for folks that gained health coverage through Medicaid expansion. And this will be an anonymous, it'll be made sure that it'll be documented anonymously, but really it's to see what did this look like before Medicaid expansion? How are you impacted? How's your workforce impacted? How's your family impacted by this? It'll then be taken from our research and data team and put into a report of key findings. Things like this, where you can put stories and data into this general picture, is really helpful when it comes to talking with legislators and informing the community. The other ways for folks to get involved, next slide, are through different media and blog posts. Again, this is highlighting specific stories on why Medicaid is so important in North Carolina. So these are 3 blogs that Emily Blevins, one of our staff members, has written over the last couple of months, all with stories that are extremely different, but the goal is the same, highlighting families that need Medicaid and have been using Medicaid to be successful. One of our stories highlights a family affected by Hurricane Helene. Others show just the long-term stories of having families with complex healthcare needs and how important Medicaid has been. This is something that folks can do in their own communities. If you are someone that is on Medicaid that has a lived experience, make sure to share that, because it puts a face to the data. And we need that, because I think folks get really desensitized from data. It's just numbers. What does that look like? But if you can put a face and a story and some feeling into it, legislators are more, I think, likely to connect with the problem, especially if folks live in their districts. So those are just a couple of examples. I'll put those also in our chat if you are looking to share your story, or if you know someone that is. That report will be coming out in April, along with a video to highlight some of our key legislators that helped pass Medicaid expansion. We'll hear from our executive director, Erica Palmer-Smith, and some other key stakeholders who have been influenced by Medicaid expansion. Is that all I have for slides? Okay. Actually, next slide. I think we have one more. Okay, so now we are at Q&A time. So we've had some great questions that were answered throughout. Leo, I know that there were a couple that you wanted to answer. If you just want to go ahead and read them aloud and then answer as you wish.
Sure. So we had one question which said, why does Medicaid pay for nursing home stays? Is it an agreement between those who have Medicare versus Medicaid? And that's a great question, and it's a great question for a lot of reasons. So even though Medicare is our, national program to provide health insurance for older adults and people with disabilities and some other populations, it covers only short-term rehab placements in terms of long-term care. And actually, my elderly dad, who has broken both of his hips, I can tell you, even that short-term rehab, those Medicare days are quite limited and they kick you out pretty quickly. Medicare does not, repeat, does not pay for nursing homes. It is actually Medicaid that pays for ongoing nursing home needs for seniors and similar placements for people with disabilities. And we have a major public messaging problem here, because people might not stand for cuts to Medicaid if they understood what Medicaid is doing. And I have to tell you, having worked in this space for clients, okay, I had clients. These are people who had some money saved up and who spent their whole lives thinking Medicaid is not about them. Medicaid is a program that takes care of other people. And then they have a stroke and they need long-term care of some kind. And that long-term care costs them $5,000 a month, $8,000 a month, $10,000 a month. And those long-term services and supports eat away all of their life savings. And suddenly they're out of money, and they're contacting me, and we're helping getting them enrolled in Medicaid and getting their coverage, right? And I had clients who tell me, right, I never realized this Medicaid program was going to save my butt one day, right? And so this program is helping so many people right now, and there are so many people right now who don't realize that one day they are going to depend on it. And I also just want to flag in this vein, it's not just that Medicaid is providing nursing home and similar types of coverage for older adults and people with disabilities, but more importantly, Medicaid is actually the cutting edge in covering alternatives to nursing homes and facilities, providing people home-based services so that they can actually stay in their home and in their community instead of getting sent, to some home or some institution that may be in the middle of nowhere, not near their community and their family and their church, et cetera, and not offer them independence. And so getting sent to a nursing home, that was like the old way of doing business. We have a new and better way, and it's actually Medicaid that is leading the development of those home-based services. So Medicaid's importance here cannot be overstated. We have no national program for long-term services and supports. The program is Medicaid. It's just kind of like we squeezed it into our healthcare program for low-income people. The second question that I saw, Hannah, which I think came up from a couple of people concerned about what services getting cut, right? So this is absolutely stressful and scary to hear and to talk about. Somebody telling you, hey, services might get cut. I want to, first of all, let's sequence this. North Carolina is not going to cut any services if the federal government doesn't slash their funding. And right now, the question is whether the federal government's going to slash their funding. So priority number one, if you're concerned about that, is making sure that people in the state of North Carolina understand what is being discussed at the federal level, and if they want to, weigh in on that issue. Second point I want to make is just assuming the worst happens, and there are big cuts, and then that at the federal level, and that translates into less dollars for North Carolina, and then the state is under pressure to make cuts. The state can't just go in and cut willy-nilly. Within Medicaid law and within CHIP to some degree, there are mandatory requirements. There are mandatory populations the state must cover. For example, children living in poverty. So the state can't just boot kids living in poverty. And there are mandatory services the states have to cover. So for example, labor and delivery. So for a pregnant person who is enrolled in the program, the state can't say, oh, we're cutting labor and delivery. So there are limits to the bad things the states can do. That's the good news. Here's the bad news. About 50%, something like 50%, might even be more, of what the states are doing through their Medicaid programs are things that are outside of that, if you imagine like a little safe bit space of mandatory populations and mandatory services that they can't cut, there's a whole lot of it that's outside of that states are doing. So all kinds of, for example, special services for these home and community-based interventions I was talking about, states could try and go after those because a lot of those are optional services. Frankly, a lot of services that people with disabilities and older adults rely on are expensive and they're optional, and so they're at high risk. Then there are a whole bunch of services that are in the optional side of the bucket that could also be at risk. So I don't want people to be totally scared for two reasons. First, we don't know these federal cuts are going to happen. We don't know how big they are. We don't know that they're going to happen. And that is the open debate right now. And if those federal cuts don't happen, your state has been a great state in terms of financing its Medicaid program. And so I wouldn't be worried if the federal cuts don't happen. And the second point is there is some process in order to what the states have to do. So it's not just like everything gets burnt down across the board. But I also don't want to give anyone a false sense of security here. When I tell you that 50% of what your state is doing is optional, that means 50% of what your state is doing is at risk if there are huge cuts, right? So this is really, really serious.
Leo, talking about programs at risk, a question came in when you were talking originally that asks, what is the outlook for waiver programs in states like North Carolina? Wanted to see if you could specifically talk about the Healthy Opportunities Pilot and just our waiver programs in general.
Yeah, so It's important to, when we use the word waiver, know that it gets used in two ways, that this can be very confusing for people. The first way that it gets used is it gets used as part of, and I'll just use the full phrase, home and community-based waiver programs. Those waiver programs, what they do is provide alternatives to those normal institutional, they shouldn't be normal, but the standard institutional placements, right? So all kinds of ways that somebody might get home-based services instead of getting forced into an institution. Those types of waiver services do face some risk because they do fall into that bucket of services that are often optional. Not every single service is optional, but a lot of them are optional, and they are quite expensive. So a state that is feeling the need to make cuts might cut those services, might reduce what services are available, might make it harder to access the program, or might, for example, cap the funding for those programs, which they are sometimes allowed to do. So, and so you get into a situation where there's a program, but there's only 5,000 slots and there's 15,000 people who want to get in. And so you end up with 10,000 people on a waiting list. That's what the bad case scenario looks like for those types of waivers. The other type of waiver is what we call an 1115 waiver. Those are special permissions the state has to deliver care in new ways, hopefully and theoretically innovative ways, right? And so, for example, North Carolina is doing some things around social determinants of health that really provide a lot of new types of benefits for people. Those two are optional things the state is doing. So it is conceivable that if the state got cuts, some of those types of programs would also be at risk because the state would be looking for ways to peel back spending. And as I said, there are certain types of spending they can't stop doing. So the places where they can grow to a higher risk. For those 1115 waiver programs, I'll also just say, in addition to this risk of federal legislative cuts, there is also a risk, a political risk, which means that what I mean by that is when the Trump administration takes over the agency that is overseeing all those waivers and starts looking into all of those waivers, they might decide that they don't want to continue some of these waivers that are around addressing social determinants of health. Obviously in other areas, we've seen the administration move against anything that is in any way connected to health equity or anything that is in any way connected to, community health. So I would be nervous that they might try and attack some of those waivers.
Thank you, Leo. I think we have time for two more questions that just came in. One of them stated, how could these Medicaid service cuts negatively impact in-school services for exceptional children in public schools and their educational performance?
So there are two routes, and if either of you are especially expert on the educational space, feel free to chime in. There are two routes. There are two ways. One is just states do to differing degrees get Medicaid reimbursement for some medical services provided in schools. I don't know if there would be any risk to those services. Children in general have a very important blanket protection in Medicaid, which is they are supposed to get services that are medically necessary to them, regardless of whether the state puts them on the official covered or not covered services list. So it's harder for states to scale back coverage for kids. So there's number one, potential impact of access to medical services. But going back to the broader point I made about how all these things are connected, if the state loses this huge amount of Medicaid money, then right now what the state is doing is committing extra resources. The state is doubling down on education because Medicaid is being heavily subsidized by the federal government. If the feds stop supporting the state on Medicaid or dramatically reduce support for the state on Medicaid, now the state is going to be, and we're all going to be in this terrible predicament where the state is going to have to decide, do we keep all of our education funding where it is and just let the Medicaid house burn down? Do we completely raid the education money to pay for some of these losses on the Medicaid side? Do we, take money out of both of them to keep it kind of even and spread the pain around? And none of us who care about children, care about families, care about communities, want to see a situation where healthcare advocates and education advocates are being pitted against each other to fight for, the scraps that are left over when they just slashed the healthcare budget for the state, because that budget is financing so much more than healthcare, kind of in an indirect way.
Thank you, Leo. Last question, which I feel like you'll like this, knowing your background in law. It's a more legal question. Could cuts then make North Carolina non-compliant with the Olmstead Act?
It just increases the risk of that a lot, right? So Olmstead is a case that now kind of stands for a principle. And that principle is that when people have disabilities, we don't force them into institutions. That is actually discriminatory to say to them, the only way you're going to get your health care is if you go live in an institution. Because I, Leo, do not happen to have a disability. And when I want health care, I go wherever I want, right? And it's unfair to a person with a disability to say they have to go to an institution in order to be able to get their health care, right? That is just morally, there's just wrong. So that Olmstead principle, what that means in practice is that when states are creating healthcare options, they have to provide some of those home and community-based, they should provide some of those home and community-based services we talked about and create alternatives for people who have disabilities so that they don't have to get forced into institutions as often. And this is a delicate, slow battle that the disability community has just done this amazing 40 years, 50 years of work on this issue, really changing the norms around how this care is provided. And to the extent that the state faces a lot of cuts and the state has pressure, the state is going to start to cut corners, and that's going to mean some of these optional home community-based services start to go away, and we start to get scenarios that look like Olmstead violations. So I absolutely think there's a correlated risk there. So you're right to be worried about that.
Thank you, Leo. Thank you, Amber. That brings us to time. So I wanted to see if you had any closing thoughts before we wrap up today.
I think I'll give Amber the say because people heard a lot from me.
No closing thoughts other than thank you guys for hanging on with us during the hour, and stay informed, talk to people, make sure everyone knows kind of the state of play right now, and let folks know in your district that Medicaid is good for the rural communities in North Carolina.
Thank you all so much for taking the time to do this. It's so important right now.
Thank you both. And for the entire group, thank you again for joining us, for spending your lunch with us. NC Child will continue to have educational materials and events like this as it pertains to Medicaid. I think in some of the chats we saw today, the best thing we can do is stay informed on what's going on. So we will try to do that in a way that is digestible and tangible. So please look out. These slides will be recorded or will be sent out. The recording will be sent out. Any questions and other resources will all be in an email following up. So thank you all again. I hope you have a great rest of your day.